Hello, my name is Sarah Partridge and I'm a consultant oncologist treating patients with cancer. My colleague, Dr. Painoska, and I have made a series of recordings to help you cope with some of the challenges you may encounter as you go through your treatment. Both of us have trained in clinical hypnotherapy following our medical qualifications and have worked together over the past decade to integrate this with conventional cancer treatments such as chemotherapy and radiotherapy. We have found hypnotherapy has been invaluable for many patients dealing with highly distressing symptoms, both psychological and physical. We are all too aware, however, how few patients have been able to access this option, and we hope to change this with these recordings. By listening to these audio files, we hope to guide you to learn to use clinical hypnotherapy yourself. Consequently, you'll regain more control over a wide variety of unwanted symptoms, and you can improve your quality of life and change your future for the better. In the same way as your conventional medical treatment has been derived from research, there is also evidence that clinical hypnosis can change psychological states and physiological responses, allowing subjects to undergo a wide spectrum of investigations and even surgery safely and successfully. Hypnosis is a natural dreamlike state where the unconscious and conscious parts of our mind can come together and communicate far more effectively. We don't realise that we drift in and out of hypnotic states every day. For example, when you're highly focused on something, you might not hear your name being called. Or perhaps you may have driven somewhere on autopilot, your mind preoccupied with something else, and you can't remember the journey when you arrive at all. Hypnosis is a natural state, and when you learn self-hypnosis, you can use your imagination to effect real changes. In time, you can get more control over your physiology and the outcomes of your treatment if you practice regularly. In the same way we take a daily tablet to treat a medical condition, hypnotherapy works best if repeated frequently. The lovely thing about hypnosis is that your sessions can be extremely relaxing and will almost certainly leave you feeling refreshed, invigorated, calm, positive, and feeling better than before. Benefits you experience will be maintained long after each session, can often be impressively helpful in dealing with a huge variety of issues without the side effects associated with many medicines. There are some key recommendations, however. It is important that you do not listen while driving or operating any machinery. Instead, find a place you can sit back comfortably, where you can relax with little chance of being disturbed. While you listen, your mind may wander off, but you need not worry. Our voices will be heard by your unconscious mind, and when convenient, you might even drift off to sleep. We can't guarantee it will work for everyone, and we don't recommend it for people with psychotic disorders, epilepsy, or severe mental illness, when it is important to seek individualized medical help. And if you're already receiving psychiatric treatment, it's always best to ask your psychiatrist if they think hypnosis is suitable for you. A cancer diagnosis is frightening for everyone and affects the whole family, not just the patient. Life seems to spin out of control following the shock of a diagnosis, and yet amidst this turmoil, we have repeatedly seen transformative changes by using these tools and coping strategies. Our deepest wish is that we can help you through this, alongside your healthcare team, and assist you to harness the strengths we all possess from within, but have often not yet learned to use at will. Thank you for listening, and we hope that you'll enjoy the process that has been designed to leave you feeling more in control, more optimistic, and less anxious about the future.